This is treatment for tension dysfunction of pronator tunnel syndrome. This will be seen as an increase in symptoms when tension in the median nerve at the elbow increases. So this will be seen with median neurodynamic test 1 position or 2. Their clinical symptoms will increase with contralateral side bending and wrist extension. Take your left ear down to your left shoulder as I extend the wrist. This will increase their clinical symptoms. Treatment for this is positioning the nerve in the anti-tension position or offloaded position. This will be ipsilateral cervical side bending. Take your right ear down to your right shoulder. Scapular elevation. The elbow is in a comfortable flexion and pronation position, and finger and wrist are also in comfortable neutral position. The next progression is taking the elbow flexion to 90 degrees. Wrist and fingers are in neutral. Upper limb is by their side. Their scapula is again slightly elevated and with ipsilateral cervical side bending. The treatment motion is extension of the wrist and fingers and contralateral side bending to apply a small amount of tension from both ends. So as I extend your wrist, I want you to take your left ear down to your left shoulder. The next progression is starting from the same position, except the shoulder is abducted to 45 degrees. Again, it's extension of the wrist with taking the left ear down to the left shoulder. And further progression of this is taking them into further shoulder abduction. Next progression is sensitizing the nerve by using contralateral side bending and scapular depression and placing them in the median nerve neurodynamic test position 1. So you're depressing the scapula. Take your left ear down to your left shoulder. And the motion for this is elbow extension, increasing the tension through the median nerve. Be careful not to excessively irritate the nerve. The next progression is through neurodynamic sequencing. The starting position or technique is with the elbow extension and supination. And then you add the other components. Take them into shoulder abduction. And the motion for this is contralateral cervical side bending. Take your left ear down to your left shoulder as I extend the wrist. So we're again tensioning from both ends. The last treatment is a simultaneous treatment of the pronator muscle and the other interfacing tissue with mobilization of the median nerve. So this is a contract relax of the pronator during the median neurodynamic test 1 position, followed by the median nerve is mobilized into the tension position. So what I want you to do here is attempt to turn your palm down towards the ground. Relax. Turn your palm down towards the ground. One more time. This is performed only 2 to 3 times so as to not excessively increase tension in the nerve.